There are millions of Americans suffering from peripheral neuropathy. Dr. Aaron Gum of Blueprint to Healthcare is here this morning. You're helping people get their lives back. But first, we got to say congratulations on your book.
Thank you. It was an amazing process.
Okay, well, first of all, let's talk about what is exactly peripheral neuropathy and what are the common treatments for it?
Peripheral neuropathy is the breakdown of the nerves in the arms, hands, legs, and feet. Okay, some of the common symptoms of those are numbness, tingling, burning, deep stabbing pain, most debilitating balance problems. We've got to worry about falling and fractures and head traumas. Some of the common treatments for that is, I call it the drug cocktail approach, drug surgeries, injections. We're trying to fit a chronic condition in an acute care model. Drug surgery injections is an acute care model.
So you're teaching actually doctors all across this country a different approach to reversing neuropathy. How is that different from the others?
Well, let me give you an analogy. So let's look at a wilting plant. Okay, if we look at that plant, what do we think we need to give it to survive? Water, sunlight, nutrients, maybe take some toxins away from that plant, environmental changes so it can thrive. Well, we do the same thing with the nerve. We're just taking environmental factors away and giving the nerve exactly what it needs. It wouldn't make sense if I go in and spray paint the leaves green again, have the leaves stick up again, or pour chemicals in that dirt to make that plant, because that's all a drug is a chemical.
Interesting. So give us some examples of how you are reversing peripheral neuropathy.
Well, when we look at a nerve, a normal nerve has a network of blood vessels in it. That's how it gets nutrients, oxygen, and blood supply for it to survive. As those blood vessels constrict, it goes down and they start to die. We use cutting-edge technology such as infrared laser boots for neuropathy. We use a stimulator device that's used in all the cancer centers of America to re-educate that nerve. We have inflammatory processes to take that patient through to decrease inflammation. And one of the things we use is around a Nobel Prize concept.
Interesting. How is your program different, though, from all the other doctors? You know these patients see a lot of different doctors.
They do.
How is it different?
Well, typically, when we go to a doctor, we go into the room, we sit there for two minutes, and he asks you a couple questions. He writes you a prescription, and then you're done. Or he sends you to a specialist to get advanced tests to tell you exactly what you already know you have. So the drugs don't change in those type of offices. So we're still trying to fit a square in a small circle, and it's not going to work. So we empower our patients, and by doing that, our patients get educated through the process, they get all the protocols, they're able to get healthy while they're at our clinic, and we empower them to, once they're gone, they don't have to depend on us. They're independent to their condition versus dependent on us. So that's how we empower our patients, and that's why our patients love coming to our office, because we don't ever see patients again unless they just want to come back to visit. And
you guys like that, they like that. It's a win-win for both parties.
Yeah, you know, it's kind of sad on our healthcare system and the way it's structured to get people healthy. We're just masking symptoms and going about it the wrong way. We've reversed that entire process, and that's why patients are so successful when they come to our clinic.
Well, you have a great offer today for all of our GMT viewers.
Yeah, the first 25 callers will get a free admission to our seminar. And when I say callers, I mean serious callers, okay? So, and when I say serious, you're ready to get healthy, you're ready to make action. You know, we get a lot of calls that just want to call and get a consultation over the phone. It just doesn't work that way. We got to really sit down and dig in and devise a plan and see if you're a good fit for our clinic. So first 25 callers, free admission to our seminar. We have 2 this week.
We love that. Good to see you.
Yeah, thank you.
Thank you so much.